I am Dr. Ramnarayan, Senior Consultant, Restorative Neurosurgeon. What is this restorative neurosurgery? This is a new branch of neurosurgery which involves surgical management of lost nervous functions. There's nervous functions get lost due to various conditions like Parkinson's disease, like stroke, paralysis, so many conditions. So nowadays, by surgical methods, we can restore this lost nervous functions. As we all know, conditions like stroke, conditions like incontinence, conditions like even addiction, all these have a lot of not only medical problems but also a lot of social connotations. A lot of lives get lost because of this, a lot of financial problems happen. So by surgery, especially in those resistant cases where no other treatment is possible, by surgical methods we can help these patients get back to a normal life. Addiction is a major issue all over the world, and it seems to be increasing. Addiction is either substance or to other things like the usual mobile phones, some people gambling, all these are addictions. Addictions are very varied. So it's a major problem all over the world, and families and even big companies have got damaged because of somebody's the managers being addicted. What is addiction? Addiction is the repeated necessity to use a particular substance. The commonest addiction is usually either alcohol or drugs. What happens is there is an area of the brain called the nucleus accumbens, and this area is part of what is called as a reward circuit. Whatever human beings do is based on a reward or getting a reward. And the nucleus accumbens being at the one of the main areas of this thing is always wants to be stimulated. So what happens is when somebody's nucleus accumbens is wanting stimulation, it pushes the person to go and take alcohol or drugs or even excess food, the binge eating, things like that, depending on the various reasons. This is a reason why some people are addicted and some are not. Of course, there is a lot of genetic as well as environmental factors which come into play. Of course, the environmental factors are bigger, and the genetic there's a predetermined genetic reason also. How do you take care of the addiction? The best way to prevent addiction is to not get addicted. But obviously, it's not possible in all patients. And there are various ways by which people tend to get addicted, especially peer social pressure and all that. It's actually more of a social problem than a medical problem.